Good afternoon, everyone. My name is Erin Hokanson. I am a nurse practitioner at the Adolescent Clinic here at Carilion, and with me is Brooke Michael. She is our health educator at the Adolescent Clinic. And as Patrick said, we're going to be talking about teen health, sleep, and mental health today. Our objectives today are review recommended sleep schedule for teens, discuss correlation between sleep and mental health in teens, update providers on community resources for mental health. And it just so happens that this is Sleep Awareness Week, and World Sleep Day is Friday. It's rather ironic that we just started daylight savings time, so we've just all lost an hour of sleep. All right, so teens and sleep. We all know that most teens do not get enough sleep, and their sleep schedule is typically not healthy. So just to review the recommended sleep duration, for school-age children, ages 6 to 13 years old, it's 9 to 11 hours. For teens, ages 14 to 17, it's 8 to 10 hours. And for young adults, 18 to 25 years old, it is 7 to 9 hours. So here's a helpful sleep screening tool, the BEARS instrument. It prompts screening questions in 5 major sleep domains. You can use this for ages 2 to 18. And the B, bedtime problems. So, do you have any problems falling asleep at bedtime? E, excessive daytime sleepiness. Do you feel sleepy a lot during the day, in school, while you're driving? A, awakenings during the night. Do you wake up a lot at night, have trouble getting back to sleep? R, regularity and duration of sleep. What time do you usually go to bed on school nights, weekends? How much sleep do you normally get? And S, sleep disordered breathing. Does your teen, this is a parent-directed question, does your teenager snore loudly? Do you hear pauses in their breathing, things like that? So why are teenagers so different? Children tend to sleep earlier in the evening, wake earlier in the morning. Teenagers and young adults sleep later in the evening, wake later in the morning, and then older adults typically shift back to the earlier sleep-wake schedule, like children. So what's the problem? Why is it so hard for teens to get good sleep? They have a change in their circadian rhythm. Teens typically don't feel tired until later in the day. Their body does not produce melatonin as early in the day. Other factors include school start times, homework, chores, their work schedule. A lot of our teens are working, after school, closing at restaurants, things like that. Their sports, social life, and then increased stress, anxiety, and depression can also affect their sleep. So this picture illustrates one reason why teens are so sleepy. They experience a natural shift in their circadian rhythm. So here you see, in young childhood, they feel tired earlier, wake up earlier in the day. The adolescent has the delayed circadian phase, so they feel more tired in the morning, harder to wake up. Other factors include use of electronics. As we all know, this is a major issue for teens and really for all of us. The bright light suppresses melatonin, also notifications that you receive from text messages, social media. As soon as you fall asleep, you hear that ding and you need to check your phone again, as well as sleep disorders. So primary sleep disorders, such as obstructive sleep apnea, this is something that you certainly want to screen for in your obese patients. if they have enlarged tonsils or adenoids. Also ask, again, the parent or the patient and caregiver about snoring and pauses in their breathing. Another primary sleep disorder is restless leg syndrome. And typically they'll complain of leg discomfort, restless sleep, taking movements during sleep, and you would want to refer to ENT or the sleep center based on their symptoms and exam. So sleep deprivation in adolescence is a common problem, especially during COVID-19. Over 50% of high school students reported an average of less than 7 hours of sleep on school nights. And this actually demonstrates that it's even a higher rate than that. This is the High School Youth Risk Behavior Survey. This is the national data, and it's a survey that's conducted every other year. And the survey asks teens various questions about health behaviors. So in 2019, almost 78% of high school students reported they did not get 8 or more hours of sleep. So their teens are getting, So the effects of sleep deprivation. You'll see decreased cognitive function, poor concentration, memory impairment, shortened attention span, increased risk of automobile accidents, irritability, depression, and poor decision making. So again, this is a major concern for our young drivers. You know, if they're new on the road and then they're also not getting adequate sleep at night. So how to improve sleep? It's always important to review sleep hygiene with your patients. You want to recommend that they limit caffeine, especially later in the day, energy drinks, soda, coffee, tea. You know, I tend to review each of those individually instead of just saying caffeine. Reset your clock to go to bed at the same time every night and wake up at the same time every morning, even on the weekends. Again, turn off all electronics at least 30 minutes before bedtime. Get regular exercise, but not within 2 hours of bedtime, and get out and get some fresh air and sunshine. Some other ways to improve sleep, you can provide relaxation exercises like handouts for them to do at bedtime, meditation. There's apps for relaxation. Some of them are Mind Shift, Simple Habit, Relaxed Melodies. Treatment, behavioral interventions and therapy, if indicated. Pharmacologic therapy is not first-line treatment, and most over-the-counter sleep aids are not recommended in children and teens. Sometimes we recommend a brief use of melatonin as the teen works on their sleep hygiene. You can administer it about 30 minutes prior to bedtime. So sleep is restorative, it's imperative for health and wellness. Poor sleep can cause or exacerbate psychiatric symptoms. Psychiatric disorders often affect sleep too. So now Brooks is going to talk about mental health resources in our area for our teenagers.
Hi, everyone. Thank you for listening today. So this picture you see here, it says everything is weird right now. Let's make asking for help normal. This is something that Healthy Roanoke Valley implemented about 6 months ago during this pandemic. So we've been trying really hard to make it normalized to ask for help because it's been a hard year. Regardless if you're 4 years old or 40 years old, we've all struggled in some way. This is just some tips. I work a lot with teens in my role inside the health classes in the high schools. I've done a lot of that this year virtually. I still get to speak to them. And so we go through some of the different ways to manage anxiety, stress, and depression, and we talk a lot about coping skills. So for example, limiting your exposure to the news, Taking care of your body is real important, and teens need to be reminded of this. I find that a lot of them like to take naps, really long naps in the afternoon. So that is definitely not good to stay on a regular schedule. We also encourage adolescents to talk to someone they trust, just even if it's for 5 minutes a day, really just making that meaningful connection with someone every day is important. And then finally, trying to do something purposeful every day. You know, a lot of them have been at home virtually learning, so having something to accomplish each day, no matter how small, really helps with their mental health. Here at our adolescent clinics, we came up this year with these little business card-sized resources, and we've reordered them actually a handful of times because we found that so many teens need help right now. We have these available if anyone would like some. This is what the first side of the card looks like. This is a warm line. This is if you have someone that just needs somebody to talk to. They're not necessarily in a crisis, but they just need, you know, a neutral person to talk to. There's certified crisis counselors available for them 7 days a week. They can call or they can text. So this is really useful. And then on the back of these cards, it's more resources for adolescents if they're in more of a serious emotional kind of distress and pain. If they need help right away, they need someone to talk to. There's 3 options here. There's the crisis text line. There's Crisis 1 of Roanoke Valley, and then there's also the Hope line. These, they can either call or text, and again, they're all confidential, they're all free, and they're all staffed with trained volunteers. We have delivered a lot of these cards to the local schools in the Valley. So if you work with adolescents, or if you would like us to get these to you, we certainly can. It has really been a good resource for them this year. Another thing I like to mention, this is good for adolescents and then for adults as well. Family Service is currently offering up to 4 free short-term therapy sessions. If you've been having trouble with anxiety, depression, isolation, or just fear, these are available to anybody ages 10 and up. It's free. You can do 4 of them, and mostly they are being done by video or by phone, so you don't even have to leave your house. This is a great resource as well that we like for people to know about. This is our adolescent medicine team. Dr. Lance and Dr. Blackwood have been with us for a really long time. They're our medical directors. Erin, Hokanson, who's with us today, and Dana are our providers, and then I am the health educator. And we also have Victoria Rosenberg, and she is our mental health therapist. She does a wonderful job with adolescents, and she actually helped us develop the mental health cards because there's, you know, such a need and patients needing to see her. So that's something they can use in the meantime until they get in to see us. So we have 3 adolescent health clinics, which is actually really unique that we have these clinics that are specific for this age group. We have 2 inside of the Roanoke City High Schools. One is at William Fleming and the other one is at Patrick Henry. At the first half of the school year, we were not open as they did not have in-person learning. But now that they are bringing students back, we are there 2 mornings a week at each high school, and we continue to expand those hours. Those are really meant for Roanoke City students. Then we also have our main clinic here. This is our adolescent and student health services. We are open 5 days a week. We see kids from all over. Anyone can really come as long as you're at least 10 years old. We see you through age 26. So we do see a lot of college-age students, and our staff is just wonderful. They really understand this age group. They really understand when we have a patient come in that often there's something else going on besides the main reason that they're there, and they're able to really help them and provide what they need so they can take good care of their health. What we do at our clinics is very comprehensive. I mentioned we have a mental health counselor. We do well visits, sports physicals, you know, minor injury, treatment. We help them if they're sick. We do family life, birth control, and family planning. So we have a wide variety of services available for adolescents. Okay, any questions? So I think that sums up what we're here to do today. So if there's questions, please let us know.